Then people have been championing HIPEC, and there was a big HIPEC trial that came out by Van Driel that was published in the New England Journal of Medicine in 2018 that touted the almost year advantage in overall survival by giving, in a neoadjuvant setting, a single dose of 100 milligrams per meter squared of cisplatin intraoperatively versus not. And they followed those women. They had a little less than a 4-month advantage in PFS, which was the primary endpoint of the trial. And then they had immature data on OS that showed almost a year's advantage. So very impressive. The toxicity looked really good, much less than what you see with other HIPEC trials. But the question is, why? It doesn't make a lot of sense. And if you look at the control arm, it really underperformed significantly. The thought was that the control arm was going to be about 18 months for PFS, and it came out to be 10.7. And if you look at the actual experimental arm in the Van Driel trial, which got HIPEC, it was 14.2. So that also underperformed what you would have expected. And so are we looking at a type 1 error here, or is it a real effect? We don't know, because it completely contradicts the HIPEC data that came out from Lim et al. Last year at ASCO, showing essentially no advantage to HIPEC and much more toxicity, also a phase 3 trial. So what to do with that? I think the data is still out. We hope that we'll get more data moving forward, but we need more randomized data in that area.